Hello and welcome. Today we're delving into a fascinating, and sometimes unsettling, condition affecting the inner ear, perilymph fistula, or PLF. We'll explore what it is, how it happens, and what can be done about it. So, what causes this disruption in the inner ear? The primary culprit is trauma. This could be a head injury, a sudden change in air pressure, like during scuba diving or air travel, or even violent sneezing or coughing. In rare cases, PLF can be congenital, meaning someone is born with it. Less common causes include ear surgery, especially stapedectomy, and chronic ear infections that erode the inner ear structures. To understand PLF, imagine the inner ear as a delicate fortress filled with fluid. The perilymph fluid bathes the balance and hearing organs. When a fistula or abnormal hole forms in the oval or round window, thin membranes separating the middle and inner ear perilymph leaks out. This leakage disrupts the normal fluid pressure and ionic balance within the inner ear, leading to a cascade of problems with hearing and balance. Think of it like a breach in the hull of a submarine. The disruption causes major operational issues. Perilymph fistula isn't terribly common, making it somewhat difficult to precisely track its occurrence. It's often associated with activities involving sudden pressure changes, like scuba diving. However, the true prevalence is likely underestimated, as diagnosis can be challenging and some cases might resolve spontaneously. Certain populations, like those with congenital inner ear abnormalities or those undergoing specific ear surgeries, may be at a higher risk. The symptoms of PLF can vary widely from person to person. One of the most common is hearing loss, which can be sudden or gradual, and often fluctuates. Vertigo, or a sensation of spinning, is another frequent symptom. This can be triggered or worsened by loud noises, pressure changes, or even simple activities like coughing or sneezing. Other potential symptoms include tinnitus, or ringing in the ears, a feeling of fullness or pressure in the ear, nausea, and imbalance. Because the symptoms are similar to other inner ear disorders, it can be hard to make a diagnosis. Diagnosing perilymph fistula can be tricky. A thorough medical history and physical examination, including neurological and audiologic tests, are the first steps. An audiogram will assess hearing levels, while electronystagmography and NG or videonystagmography of VNG tests can evaluate balance function. A fistula test, which involves applying pressure to the ear canal and observing for eye movements indicating vertigo, may be performed. High-resolution CT scans or MRI of the inner ear might be used to rule out other conditions, but they often can't directly visualize the fistula. Unfortunately, there is no gold standard diagnostic test, so doctors often rely on a combination of findings to make a diagnosis. While PLF is primarily defined by the presence of the fistula, it's helpful to classify cases based on the location and cause. Fistulas can occur in the oval window, the round window, or both. They can also be categorized as traumatic, barotraumatic, pressure-related, congenital, or iatrogenic as resulting from medical treatment. This classification helps guide treatment decisions. Treatment for perilymph fistula typically starts with conservative measures. This includes bed rest, avoiding strenuous activity, and elevating the head. Medications like anti-no drugs and anti-vertigo medications can help manage symptoms. If conservative treatment fails to improve symptoms, surgery may be considered. The surgical procedure involves exploring the middle ear and patching the fistula with tissue or other materials. The goal is to seal the leak and restore normal pressure within the inner ear. Preventing perilymph fistula focuses on minimizing the risk of head trauma and sudden pressure changes. Wearing appropriate protective gear during activities that could cause head injuries, such as contact sports, is crucial. When scuba diving or flying, equalizing pressure in the ears frequently can help prevent barotrauma. Avoiding excessive straining during activities like lifting heavy objects or coughing vigorously can also be helpful. For individuals with known inner ear weaknesses, a more cautious approach to these activities is warranted. The prognosis for perilymph fistula varies. Many individuals experience significant improvement with conservative treatment or surgery. However, some may have persistent symptoms, such as hearing loss or balance problems. Early diagnosis and treatment are essential for maximizing the chances of a successful outcome. Research is ongoing to develop more accurate diagnostic tests and more effective treatment strategies for this challenging condition. Current research explores the use of advanced imaging techniques, such as high-resolution inner ear MRI, to better visualize fistulas. Additionally, researchers are investigating new surgical techniques and materials for patching fistulas, aiming to improve long-term outcomes and minimize the risk of complications. The future of PLF management looks promising, with ongoing efforts to refine diagnostic and treatment approaches.